Hey there! Welcome back to my YouTube channel. So, today we are going to discuss the most Googled question, how to remember everything you read and how to retain it for longer. Without any further delay, let's get into the video. There are 7 simple tricks to remember everything you read and retain it for longer. Here they go. Trick number 1. Photographic memory. What is this photographic memory? It is remembering the information or visual images in a very great detail. Okay, let me give an example. You have read a page. Now, close the book, try to recall all the topic in that particular page. When you try to do this, you'll recall the page from top to bottom in the same order you have read. This is called pictographic memory. Okay, let me make it clear with another example. Now, you're trying to study the definition of erythema nodosum. What is it? It is inflammation of the fatty layer of the skin which results in red, hot, nodular appearance on the anterior aspect of the leg. Now, try to recall it. Yes, you'll recall almost every word of the definition because of your short-term memory. But when you try to recollect the information after a day or two, you hardly remember the definition. Now I have a solution for you. Now, see this image. You can appreciate red, hot, nodular appearance on the anterior aspect of the leg. Your brain perceives this image so easily because it is self-explanatory and it stores the information for a very longer time. This is why the pictographic memory works like a pro. Are you trying so hard to remember the subject by by-hearting it? No, that doesn't work like that. Now, I have a trick for you. Trick number 2. Don't by-heart it. Just understand it. Let's take the same example, erythema nodosum. Try to understand its name. Erythema means red, hot. Nodosum means nodular. Yes, when you try to understand or derive its meaning from the name, or I can say the concept behind the topic you are studying, believe me, you will never forget it. Trick number 3. Mnemonics. This is everyone's favorite and most of us are aware of it. Let us try to understand how efficiently this trick works with this example. Tell me, what are the relations of the neck with first rib from medial to lateral? Go on. Ma'am, sympathetic chain, superior intercostal artery. No, ma'am, first thoracic nerve. Oh, no, ma'am, posterior intercostal vein. This happens. We usually get stuck in answering such questions. In these situations, mnemonics help a lot. Let's try answering this question with a mnemonic SWAN. S-W-A-N. Sympathetic chain, first posterior intercostal vein, superior intercostal artery and first thoracic nerve. In this way, it is quite easy to remember such puzzle topics without any confusion. Here I have a note. Mnemonics should be easy to recollect. Don't make mnemonics which will require another mnemonic to remember the original one. Trick number 4. Make up stories and relate the subject to what you know. What does this mean? Let's try to understand it better by taking examples of these two topics, gout and pseudo-gout. I have studied these two topics 2 years back and even today I can recollect them so easily because I have made up an interesting story to remember them for longer. What is this story about? It is about two famous Indian film actors, Prakash Raj and Siddhartha, who starred as father and son in the movie Bommarillu. So, the story goes like this. One day, you have Siddhartha as your patient in your OPD. So, you see the patient and he is a male around 30 to 50 years old. Now, Siddhartha starts complaining you, "Doctor, these days I'm having severe pain in my great toe and sometimes my ankle also hurts a lot, doctor." Okay, sir. Can I know your dietary habits? I mean, are you a vegetarian or non-vegetarian? Basically, I'm a non-vegetarian doctor and I consume high non-vegetarian diet. Okay, sir. Do you take alcohol? I mean, occasionally or regularly? Alcohol? Yes, doctor. I drink beer and sometimes wine also. Sir, are you on any other medications like for hypertension, diabetes, or any other medication so that I can know the etiology of your condition, sir? Yes, doctor. I'm a hypertensive and I'm on a drug called Lasix. Okay, sir. Let's do some tests and infer the diagnosis after the test results. You do a test to detect serum uric acid levels, and for further confirmation, you do the diagnostic test of urine examination under microscopy, and you observe a strongly negative birefringence of needle-shaped crystals. So, you confirm the test gout and tell the same to Siddhartha. Okay, doctor. So, I have a condition called gout. Why does this occur, doctor? What is the reason I'm having this? Is there any effective treatment to cure this, doctor? Actually, sir, this condition occurs because your kidneys have failed to excrete a waste product called urate, and your drinking and dietary habits are also aggravating your condition. As you're on Lasix, this drug still more aggravates your condition. So let me switch your antihypertensive med to a more safer one called losartan. This is quite safer drug in patients having gout. So treatment wise, take some painkillers in acute pain. And chronic prophylaxis wise, there are two drugs called allopurinol and febuxostat that will do the purpose. And if there is any further kidney damage, we can switch on to intra-articular steroids. Okay, doctor. What is the prognosis of this condition, doctor? Will I get better? Are there any risks, doctor? Will I need a surgery? So no need to worry at all. Gout has quite favorable prognosis and your joint can be preserved. Rarely, in some cases, they will need surgery, but let's hope that doesn't occur. By hearing this, Siddhartha becomes happy and he leaves the clinic. Now, next patient in the OPD is Prakash Raj. So, you see the patient, male, more than 50 years old. Now, Prakash Raj starts complaining you, doctor, these days my knees, my shoulder joint, my hips aches a lot, doctor. Let's do some tests and see according to the test results. You have done a test to detect serum calcium levels, and for further confirmation, you have sent this urine sample for urine examination. Under microscopy, the test results come positive for pseudogout, that is mildly positive birefringence of rhomboid crystals. So you confirm it as pseudogout and tell the same to Prakash Raj. Okay, doctor. Why does this occur, doctor? Can I get a better treatment and get well soon? This is a joint degenerative condition. Your joint can get damaged further, and you might also require a joint replacement surgery. So please try doing some walking, physiotherapy, and please avoid taking unnecessary calcium and vitamin D supplements. They will degrade your conditions a lot more. Have acute pain, try some painkillers, and if there is any further renal damage, let's try intra-articular steroids. In this way, you can create some interesting stories to make the subject a lot more interesting and easy. Subjects, hundreds of topics, thousands of pages. Scary, right? Why fear? I'm here. Yes, I mean it. Trick number 5. Make flashcards and summaries. There are many topics which are quite a lot to remember. In such cases, flashcards serve the purpose. Let's take the example of CRAO, Central Retinal Artery Occlusion. Here is the flashcard which contains almost every important information you need to know about CRAO. Hence, flashcards help you remember what is most needed in just a small glance. The same thing applies to summaries as well. Trick number 6. Draw out the differences. Let's try to understand it by drawing out differences between two topics, CRAO and CRVO. What is the most common cause of CRAO? Atherosclerosis of common carotid artery. What is the most common cause of CRVO? Atherosclerosis. Most common site of occlusion in CRAO. It is at the site of entry of central retinal artery into the meningeal sheaths of optic nerve. Most common site of occlusion in CRVO at lamina cribrosa. Typical appearance of CRAO is boxcar or cattle truck appearance, typical appearance of Cia Vivo, blood thunder or splash tomato appearance. So, in this way, when you try to make out differences between two nearer topics or any nearer topics, you can learn the subject without much confusion. Last but not least is revision. Yes, we all know how crucial this revision part is. There are some topics which are so dry, be it fact, numbers, volatile topics and so on. These topics can't be cut short to a flashcard, no mnemonics work, can't storify them, and they don't even have a concept to understand. Such topics need repeated revisions. These repeated revisions potentiates our hippocampus to convert our short-term memory to long-term memory and store the information for a longer period of time. What you need to do here is just write down all the volatile topics or whichever topics you find difficult to remember on a piece of paper or a stick notes and paste it on your wall or door or any place where you find easy to have a quick glance at it. And hence, revision remains only solution to nail such topics. These are the 7 simple tricks that will help you out to remember and retain the subject for longer. Let me summarize what we have discussed in this video so far. 1. Photographic memory. With this technique, you can remember the information and images in a great detail by just making use of your visualization. 2. Don't by heart it, understand it. Try to understand the concept behind instead of just by hearting it. 3. Mnemonics. Write up some cool mnemonics and retain the topic for longer. 4. Make up stories. Make some cool stories about the topics you find difficult to remember and relate them to what you know. 5. Make flashcards and summaries. Prepare some flashcards and summaries of lengthy topics and use them for quick revision. 6. Draw out the differences. Differentiate similar topics and learn them without any confusion. 7. Revision. Write down the volatile topics on a paper and paste it somewhere for everyday reference, and please keep revising them. So that's it guys, this is about our today's video, and please let me know in the comment section below how well these tricks helped you out in your studying. Don't forget to press that thumbs up button, and for a lot more videos like this, subscribe to my channel.